Hi there, I'm a registered massage therapist and a Guild certified Feldenkrias practitioner and the owner of VV Therapy. A few years ago I developed and put together a continuing education course for RMTs and had it accredited through the CMTBC, so the College of Massage Therapists of British Columbia, Canada, to hopefully get you excited about what you'd be learning during this program. Developed this course to help people solve some problems that they're having in their private practice. Often we see people repetitively with the same issues. You know, they've got the same level of tension on the right upper cervical, suboccipital area of their neck. They're getting headaches. They've got, they've had a rotator cuff problem in the past. They still, don't have full range of motion of their shoulders. They're having difficulty with that. When we work on them, we see asymmetries of muscular antagonist, agonist, maybe if they've gone to a physio or if you've assessed them yourself, you're figuring out that, they might not be firing some sort of muscles on one aspect of their body compared to the other. So it doesn't matter. Those things actually can be part of your thinking around your assessment of your client, but when you take this course, you will learn how it is actually the skeleton that you want to focus on in terms of movement. The movement of your upper body needs to be driven off your lower anatomy where you have more power. So this is the focus in my course, and what you will be learning is very hands-on. We start with doing our assessment protocols for movement, then we move into you actually laying on the floor, learning awareness through movement sequences where you can feel what we're learning in your own body so that you can then apply that to someone else. One of the things that we'll be assessing is ipsilateral and contralateral movements of the skeleton throughout the body and how the trajectory of both contralateral and ipsilateral motion all the way from the pelvis up to the head and in standing, of course, from the feet actually influence what's happening with the head. So we do have a world now that is very visually oriented, and so a lot of the problems that we see in our practices are, sort of handed domination, like someone being more right-handed, being more right visual, and then, having a lot of, sort of tension coming from that, just from sitting at a desk or sitting at a chair or looking at a screen of sorts. Not to just limit this this course to those kinds of conditions, but to actually what we're going to be doing is assessing people's capacity of movement of their head, how much of the rest of their body is actually involved, how can we show them how to get a trajectory of motion more happening from their pelvis and their legs, how can we look at the rib cage as the main source of rotation for the head and the neck. So, the upper rib cage, which is actually inserted into the sternum here down to T7, how does that relate to the use of the arms? Now, that is exactly how a Feldenkrais practitioner is taught in a 4-year training. So by no means does this teach you to be a Feldenkrais practitioner, nor could you use the Feldenkrais words as you being some sort of practitioner of that method. But I am taking principles and fundamentals from the method, having practiced it since 1996, and I'm showing you how to look at the body from a movement perspective. So having said that, I just would really encourage you to come to my course. It's approved until the end of cycle 11. I'll be applying for cycle 12 as soon as